The recent development of the Covid-19 pandemic has led to hospitals and clinics being swamped by patients concerned that they have been in contact with suspected patients. Deputy Health Director General Datuk Dr. Chong Kheong said that overwhelming healthcare facilities out of fear would deprive those who really have the disease from getting screened and isolated. In a recent media conference, Dr. Chong shed some light on the process of screening and testing.
A case, of course, is a very simple, straightforward thing where if we classify you as a case, that means you are actually positive. Now, before you become a case, we classify you as a PUI or a contact or a sporadic case. But thankfully, we don't have any sporadic case for the moment. Now, a PUI is a patient under investigation and is a symptomatic coming back from designated countries. A contact, of course, is a person in contact with a positive case. We emphasize on close contacts, not just casual contacts. And why do we say close contacts? It's because of the method of spread. If you recall earlier, the method of spread is droplet, not airborne. So if we were in this room having a meeting and I happen to be infected, but those of you who sat behind and wisely, you will not be affected. But if the mode of spread is airborne, it may even reach as far as 10 feet, 18 feet. Close contacts are the ones that we screen and not casual contacts. Irrespective of whether you are PUI or a contact, the moment we know you are either category, we are going to screen you and you are going to be isolated either in the hospital if you have symptoms or at home if you are relatively well before the results are known. We do not wait for the results to be positive. This prevents people of this category to spread their diseases in the events that they turn out to be positive.
The Health Ministry said it is unnecessary to test those who do not meet the criteria, but they may be advised to self-quarantine if necessary. The Ministry is providing the Ask the Doctor service on its website. Those who are not under the Ministry's advice for tests but still wish to be tested can contact 11 private service providers to go to their homes to be tested. They will have to bear the cost of about 700 ringgit plus travel costs depending on the distance.